Okay, part two. So, the main first aid kit. So basically, this, and obviously this carries a lot of potentials. The price is hard to know because some of the product right now I'm trying is they've been supplied by in conference that I found and things like that. So I'm not quite sure how much it is because some of those bandage are pretty expensive. But I'll do another video just on the bandage and how to use those bandage that I have here. But it's pretty much just my first aid kit and what I carry. I forgot the name of the pouch, but it's pretty good. As you can see, it's pretty full, but it carries a lot of stuff there. This is more than just a weekend, and it doesn't weigh much. Which compared to like if I look like for example the Adventure Medical Kit, which is basically the ones that I a lot of recommend, their expeditions ones, they're much bigger than that, and I'm pretty sure I could go for a week or two with that stuff, especially with the dressing. And this is where the difference makes, is those dressing that I have in there. I have way more capacity than other stuff. And so I would probably have to add like maybe medication and stuff, but like for a group of peoples and stuff, and especially like when I go, I never go just because of me. So it's always like, because when you have knowledge and stuff, you always want to help other peoples and stuff like that. So I always carry a first aid kit more for helping other people than really just for me. So that's why it kind of that size as well. But I mean, it fits in my day pack, and obviously it fits in my bigger pack. Not much. Not too big, and yeah. So on the outside here, I got a Strike Force with the wet fire right over there. So I got Surefire, and again, that's what I was talking about. So basically, if I have an hypothermic patient grab my bag, I can start a fire right away. And in the past, I showed you my video on what I carry in my backpack, and I'm gonna do another one now because I'm carrying my winter backpack. I didn't want to think on the summer, but I carry a body bag, and so now I bought a new one as well. And so basically, it's Sure Shelter, Surefire. So this is what I have right there, and it's for Surefire, as well as I have a little repair kit with this, and so I have like a little repair kit, and I got a needle for repairing, and as well as I got bank line and some just very duty line to do some suturing, not suturing as suturing wounds, but sewer, like to repair like a backpack and stuff like that. So this is what's attached there. So when you open the kit, it doesn't explode, which is good. So it's one of those kits that has like those things that I can kind of open. So as you can see, it has a lot of stuff in there, so we'll start with this one. So this is, once removed, is basically what the kit looks like. So this is the top part, and that's the other part right on the side there. We'll go through it. So this is my bandage. Yep. And all of this, basically, I can take care of every bandage, every kind of wounds that you can have, and only like for 1 or 2 days. We're talking about 7 days. 8 days, and that's why it's great with those dressings that I have in there, is to take care of those wounds. I won't go through this one much because I'm going to do a whole video on just this, on wound management and everything, and so I'm thinking I'm going to skip this just so I give more time on what I carry in my first aid kit. But I'm going to do a full first aid kit stuff, but it's just to show you this is how much I carry, and literally I can take care of every wounds I have in there, and for a long period of time. So that's why, and I'll do a full video on this because there's a lot of information to be given just on that. So I'm going to do a full video of this. So we'll start with this part over here. So right over here, I got a O2 sat monitor. So basically what it is, like now the battery is kind of reversed so that it wouldn't go by itself. So basically all it is that it's a little clamp that you put on your finger. So you put your finger over here, and probably if you've ever been in the hospital or something like this, you saw those. And so basically what it would give you is your saturation of oxygen and your pulse. Just a little monitoring device, a little bit. It's not, it has this limitation because like if you're in a cold environment and everything, your fingers maybe, but it still kind of helps me a little bit with monitoring some patients and stuff like that. So, especially at high altitude sickness, or if I have somebody that I think has like COPD or asthma, so I could monitor their level of oxygen, which can help me a little bit. It's still limited with the numbers that you have, but it still gives you number. It's better than nothing. So it's very compact, very small, so pretty good. But again, you have to know what you're doing with those, and you have to know the limits and the reason you have to do. The next thing right over here, it's honey, but it's medical grade honey. And the reason where there's medical grade honey, and I just learned that on my wound conference. I didn't even know they did those. So this again is a sample. I don't know how much it costs, but as you can see, it looks like a hand cream little size. But now it has multiple use. I can use that because it's honey. So, but it's just that they make sure that there's. If you use regular honey on wounds, because some people say, okay, I can use honey on wounds, and it's true. But the problem is that some honey, especially if you use ones that has been biological or that's been like raw made or something like that, they can be like some bacteria in it that get transferred, and you can have like a bad case of sepsis. I forgot the bacteria it can be, but you can have some bacteria. So what they do is basically they make sure that the honey doesn't lose its property, but as well as it's sterile, so there's no bacteria really inside it. And so it's way more expensive, but for sure now I can use it on wounds, and as well as now I can use it for if you have, for example, in a survival case, that means I could eat that. And as well as if you have a diabetic and have low hypoglycemia, so I could use that as well. So again, multi-purpose items that I can have. So right now I'm trying it. I'm trying to see, that package came, it was not a donation, but a kind of a test thing that I was able to get at our conference, and so I'm going to see how long does it last and everything and stuff. And so I don't know exactly the price of those things. Then over here I had a little bit of razor blades. This is the Twinjet EpiPen. So an EpiPen is something if you have an anaphylactic reaction, but Twinjet is basically and I'll probably do a whole video on just that because it's worth to talk about and have like a big demonstration of how to use it. But basically what it does is that instead of having only one dose, it has 2 doses. So you can use 2 doses of EpiPen, which is what is recommended when you go in the wilderness, because a lot of time, let's say you're 6 hours away. So if I give you my dose of EpiPen, and you can have so let's say you're 6 hours, for whatever reason, from the hospital. Well, you can be good for 4 hours, but by the time that you get the rest of 2 hours before you get to the hospital, you could have another reaction. So at least you have another dose that you can give. So that's why the Twinjet is a little bit better, or you can have like 2 EpiPens. But that I got as well is Afterbite for itches, and Polysporin cream, and Benadryl cream. And this can have multiple use as well, not only just for the itches and stuff like this, but it can be used also for different use, and I'll do another video as well on wound closure, and because it's different. Wound management and wound closure are two different things, and I'll do a video explaining the difference between them. But basically, wound closure is you close the wound, and wound management is you let the wound heal by itself, and with the help of like dressings and things like that. But you're letting the wound close by itself, and this can be used for some of the stuff, and I'll talk about it a little bit after. Whole bunch of gloves, whole bunch of pills, medications, and things like that, and as well as I'll go through that on a separate video on explaining that the drugs, because there's a lot of over-the-counter drugs, but not because they're sell over the counter that they're not dangerous. I mean, everything is a poison. Honey can be a poison, water can be a poison, everything is a poison. It's just a question of dose. So I want to do a whole video kind of explaining the why and the stuff, and what to be careful for and stuff like this. And so this is the bag that I carry, and it's probably what I'm gonna use for. 2 condoms, again, multiple use for survival stuff and everything, as well as in medical use. It can be used on carry another device called a Foley, and it can be used for gynae emergencies and stuff like this. So there's a lot of use with this. Yep, this is a spoon. So different use as well. It can be used as a splint, as well as, let's say, an eye protectors and things like that. But also it can be fashion. I read a video, and it can be in a fashion for intubation as well. So and I'm not demonstrating that on the internet, but yeah, it has multiple use as well, and yeah, so a spoon. You can also use it if you had to give, like, for example, medication or something. If you had like a corpse there, if you want to measure stuff, you could even maybe use the inside over here and do like a pair of glasses, like we were talking about it in the previous video. This one you could, obviously because it's metal, you wouldn't be able to do holes in it, but you could, but it would be harder, but you could still use it for maybe shape your holes and stuff. So multiple use. This is, I talked about it in my airway video as well, is to be able to administer, this is missing a piece here, but it's to administer a Ventolin injection. So basically what you do is you put the Ventolin over here, and then there's a piece that goes into your mouth there, and you can give it. And it's just basically, it just helps, because Ventolin a lot of time is misadministered, and probably I'll do a video as well. I'm getting all those ideas by doing this videos that I'll probably do on asthma, more towards the summer, because a lot of the allergens and stuff are outside and stuff. So we'll talk about it a little bit more, but this is basically what it is for. And this wound closure, we're talking about it. So basically, this is 2 staples. I don't carry suture kits. I don't close wounds very often. I don't really, and I'll talk about it more in my dressing, but I do carry these because they have, again, multiple purpose, and I'll talk a little bit more when I do the video on wound closure. But basically, they're staples, and as you can see, like, see from my hand side, that's how big it is. And there's 2 kits in there. Basically, I think I got 5 on one, and can carry it. Well, you can buy 5, which those are 2 5s, but you can have ones also 25 that are at that size. So basically, you can have 50 staples, but 10 is sufficient for me. So that's why I carry those 2. So, but not big, and can carry stuff, as well as duct tape and sport tape. And it looks like we'll have to do a part 3.